the overall bone mass goes down, decreases. So osteoporosis, there can be primary osteoporosis, which happens as we age, as we grow older. In men after 70 years of age, in females immediately following menopause, the primary osteoporosis sets in. Okay. So in order to prevent that osteoporosis, what we need to do is we need to have a deposition of bone mass at a very early age, at a very young age. Okay. So because up to mid-30s, our bone mass is in a positive state where we can deposit bone by increasing our nutrition, by increasing the physical activities, weight-bearing activities, resistance activities, wherein our bone frame and bone mass will increase along with proper nutrition. Because after mid-30s, this is a downward trend, and we can only retard the deceleration or retard the downward fall of the bone mass. Okay, this is the natural way of fighting osteoporosis or not getting to the stage where we require a medical management for osteoporosis. So in medical management, various drugs are there which can be started depending on how severe the osteoporosis is, at what stage you have come, and what is the requirement.
Okay.
How do we calculate that? How do we calculate that? Various scoring systems are there. What is the risk of fracture in each individual? We can know that. The risk of fractures in each individual can be calculated depending upon their ethnicity, depending upon their habits like smoking, depending upon whether any of the family members, particularly the mother, has had fractures in the past, depending upon whether they themselves have had small fractures, a wrist fracture or not. Then we can calculate what is their chances of getting a fracture due to osteoporosis and can start treatment accordingly.
Okay. Okay.
Preventive aspects mainly are weight-bearing exercises. So one has to put weight, one has to walk. If one can run, cycle, whatever is possible. But weight-bearing exercises are a must to prevent. See, bones follow nature, and nature is very strange. It follows a law called as Wolff's law. It states that only those bones will prosper or will become healthy wherein you put weight on them, you use them. So even if a young adult, young healthy male person puts his arm in a cast for 2 months, the bones will be really weak, even if he's eating well. But if that limb or that arm is not doing any activity, the bones will just lose their calcium, they will become very weak and very brittle. Okay, so that is the reason why we insist that some activity should be done, particularly against gravity. That is possible, sit-ups, push-ups, whatever is possible, or walking. That will encourage bone mass deposition and will not ultimately lead to osteoporosis.
Right. Okay. Thank you so much for that insight, sir. Sir, talking about the situation right now also, do you think staying indoors and having a restricted movement, especially during this pandemic, and now the impact on it has impacted the bones as well? If yes, how would you explain that?
Yeah, this pandemic is really, this is an eye-opener. From the bone point of view, we have not seen a decrease in the rate of fractures happening in this pandemic. Okay? Even though the outdoor activities are less, even though the number of vehicles on the road are less, but fragility fractures within the households have not decreased. So that's a bad thing, because obviously when we are not going out in the sun, when we are not walking, when we are not doing activities, our bones are constantly getting weaker. So the fracture level will remain the same. But then again, during this pandemic, the effect or the focus on individual health has increased. Okay, so that's the positive side. That's the silver lining to all this, that at least we are aware that we need to have a better immunity, we need to have better strength. And if you see the sales of health equipments going up, people are conscious. So that's a positive side of it. So how do we maintain bone health during pandemic is important. Even our Prime Minister yesterday was talking about the Fit India movement. And Milind Soman told that 8 by 10 room is good enough to have a physical fitness. So you don't really need to go out for that. Within the room, you can do all the exercises. You can just use household items for weight bearing exercises also. Skipping is possible, jogging is possible. And even if you are going outdoors, cycling is a very safe exercise even during pandemic. You don't need to touch anybody, you don't need to interact with people, and can safely be done. So that part, because people have become more aware about their own health, is a positive. Okay, and now we should look at improving the bone health, doing activities within the confines. If you are confined to a room, you can do activities within that room. But otherwise, if you can walk, start with walk at least, and then you can graduate to more strenuous exercises. Healthy diet, again. So good that in pandemic, people are eating well. That's the latest report. In pandemic, people are eating well. They are more focused on good quality nutrition. They are eating more green leafy vegetables rich in calcium. So that's helpful. So it's both ways. Awareness has increased definitely during the pandemic.
Yes, that's very true. Since the whole pandemic has actually happened, everybody has really become very serious about health and in all aspects of health. So we are having a question. Somebody is asking, I'm 84 years old, diagnosed with osteoporosis problems. I walk about 2 kilometers during the day and also do yoga, but I still have a lot of pain in my lower back. Are there any specific exercises or food supplements to improve osteoporosis condition in my case?
Yeah, very good. If at 84 you are able to walk for this long and still do yoga, it's very encouraging, it's very healthy, and you should continue to do all these activities. Besides that, for low back, specifically for low back, it may not only be an osteoporotic issue. At this age, there may be various other conditions which can cause low back pain. But yes, you can increase the protein intake in your nutrition as well as the calcium intake in your food. And plus, if required, medical management at this age, if established osteoporosis is there, then medical management for osteoporosis, various drugs are available for osteoporosis. You should try to strengthen your back muscles as well as your abdominal muscles. That will help in decreasing the osteoporosis. You're already walking, so that's pretty good.
Okay.
And if established osteoporosis, then medical management at this age is advocated.
Okay. All right. So, like you were when you were discussing your presentation, you mentioned about female going through osteoporosis in a much prone case. So, is this a myth that women are more prone, or is it actually a fact? And also, firstly, I'd request you to answer this.
Yeah, no, it's a fact that females are more prone to developing osteoporosis because females at menopause lose their hormones. These hormones are important in building of the bone. So the building process, there are two processes happening. Bone is a living organ. It's not like a wooden furniture or a steel frame. It's a living thing. It constantly is being deposited and constantly being eroded. Okay, the process of deposition and erosion. So if the deposition is more, then it's a positive grade and the bone will become more healthy. But they require certain hormones for this. And in females, because post-menopause, these hormones levels go down. So the process of deposition of bone or formation of the bone is much slower than the process of resorption or eating out of the bone. So ultimately, the bone becomes weaker and osteoporosis will set in. So it is true that in females, post-50, chances of osteoporosis are much higher, while as the same thing, which till now, osteoporosis in men was not really considered, but a serious issue, recently has emerged as a very serious issue, particularly post 70 years of age.
Okay. Okay. And so there's another question. There's a female patient. She has been on thyroid medication and complications of PCOD as well. So how can she prevent osteoporosis conditions?
See, whenever you have hypothyroidism, then again you become prone to developing osteoporosis. There are various other conditions where you are prone to developing osteoporosis. So you need to improve your nutrition. You need to take adequate amounts of calcium requirements, daily calcium requirement, and vitamin D requirement as recommended. So at this age, even at 40, she should start with calcium and vitamin D supplements if the nutrition is not enough. Generally, we get around 400 milligrams of calcium in our nutrition, in our food, and we still need around 400 to 500 milligrams of calcium as supplements. So she can start supplements right now, and that should help her.
And I think that goes for all women who cross 40, right?
Yeah, the focus actually should be up to 35 years of age.
Okay.
You should try to build our reserves, because after that, it's only a downward trend. We can only retard that process. But we should focus on younger people to build up the bone mass, to increase, not to have osteoporosis or a normal bone mass at 30, 35, because then after that, people start losing bone, whatever we do. We can only slow down the process.
Okay.
Focus should be at much younger age.
Much younger age, absolutely. So another question: how to enhance the gel in the knee, given that the person is active doing exercises like walking, yoga, taking balanced diet as per their assessments?
See, all joints basically are lubricated with a fluid which is known as synovial fluid, which in a knee joint is not more than 5 ml in a normal knee joint. Okay, so we do not want to have tons of synovial fluid within our knee joint. What happens is that when osteoarthritis, another condition which we have not spoken till now, is pretty common. Osteoarthritis is basically not a disease as such. It is aging of the joints. It's the wear of the joints, because some people are more prone to it and develop wear of the joints at a much earlier age. Otherwise, all of us will undergo this process at certain age. The joints wear off. And the natural response of the body to that wear is that it throws a lot of fluid inside. So you see that most of these people with osteoarthritis will have swollen knees because there is a lot of joint fluid. Okay, the synovial fluid is there. So the grease has not decreased actually. So what has happened is that the cartilage, which is the shiny surface on the joints, which keeps frictionless movement, which gives us frictionless and noiseless movements. Even the best of cars make noise when they are moving, but our knee joints don't make any noise when we are moving. So it's a very efficient process, and very small amount of joint fluid, synovial fluid, is what lubricates the joints. And when this cartilage is damaged, there is excess amount of this joint fluid which is made, because body tries to clean up whatever debris is there. And how do we prevent that? How do we prevent osteoarthritis? Is by doing exercises. See, for knee, for example, knee joint, if we do the quadriceps exercises, even while sitting, that's called as static quadriceps exercises. We are not moving around, but even in bed or even while standing or sitting down, we just contract our quadriceps muscles, just try to straighten the knee joint. And that contraction itself will circulate this synovial fluid. And the synovial fluid is the fluid which gives nutrition to this cartilage. So the cartilage is nourished, it remains viable, it remains fresh, and we can prevent osteoarthritis from happening. So simple exercises, just contraction of the knee, just tightening this quadriceps muscles will give us a lot of benefit.
Okay. Sir, I think there is somebody who wants to ask a question. Mr. Sanjeev? Mr. Sanjeev Kaushal, are you there?
Yeah, ma'am. I'm here.
Yes, welcome.
Thank you. Good afternoon, Dr. Raina.
Good afternoon.
Sir, I'm Sanjeev Kaushal and I'm hailing from Himachal Pradesh. Actually, sir, way back in 96, 97, I had an accident. So, in which I had a slightly hair fracture in L2 and L3. I don't know exactly the L2 and L3. So everything is okay, but I had to rest for at least 90 days, complete bed rest. So after that, it's okay, but as my age is I'm now 43. So so I'm slightly feeling bit pain more often while sitting for longer hours and standing for longer hours. So could you suggest some exercises so that I could strengthen my those lower back? Because I for last 2 years I have been going to the gym, and that seemed more quite I'm feeling quite well from that.
Yeah,
So is
that's
there
true.
anything more which I can do through the exercises to strengthen my lower back?
Yeah. So you see, if it was a hairline fracture and you have
Mhm.
recovered from it, you should consider yourself a normal person. So don't be under the burden that you had a fracture and now there is any problem. So if you have recovered from that, gymming is a very good thing if you have started that. But before you start lifting weights, before you put a lot of stress on your back, you should start strengthening your abdominal muscles, your back muscles, and then only do upper body strengthening exercises or lifting weights. Um, so you're on the right track right now. So go ahead, start gymming and do weight exercises. That should help. That should help.
So uh, is there any harm if I will go for the physiotherapist for, because after having doing exercise for more than 1 hour, I feel bit constricted throughout
Absolutely
my
no harm.
back.
Absolutely no harm. It is welcome
Yeah.
that you have a guided exercise program. That is much better. That if there is somebody to guide you to start the proper exercise program, you have a proper regime to do those exercises. It is always welcome. So under guidance, that's the best thing you can do.
Okay. Thank you, doctor. Thank you.
Thank you, Mr. Sanjeev. Anybody else who is asking a question?
Yeah, I have received a question that it's a cracking sound in the knee
Yes.
or ankle joint at the age of 20 to 25. Is it related to calcium deficiency? Generally, no. If there's a crackling sound from knee joint at the age of 20, that means that there is something of a sports injury, something maybe a meniscal injury within the knee joint, and you should get it examined by a doctor. Maybe there are some investigations which are required, which should be done, and that is how we'll come to know what is the sound coming from. At this age, at a young age of 20, it cannot be because of osteoarthritis. So one has to investigate at this age. You should see a doctor.
Okay.
Okay.
So I wanted to ask you another question. What actions can be taken if someone develops joint pains? When is it advisable for a person to seek medical help?
At the earliest, actually, being a doctor, yes. But see, if we ask 100 people, common people, 90 people will say that they have had joint pains in some stage of their life. So it's absolutely normal to have occasional joint pains, depending upon the age. In young children, it will be the growing pains, which is normal. In young adults, it might be small sports injuries, which is absolutely normal. In middle-aged females, a lot of household work, but there are certain conditions which happen in middle-aged females. Again, self-limiting conditions will be okay within 6 months of time. So they are normal. As we come to the age of retirement, early osteoarthritis will set in. So again, pretty normal. And regular exercises, good nutrition should take care of them. The problem is that if you have multiple joint pains, if you have joint pains every single day, if you have joint pains associated with any particular movements, or when you wake up, your hands and your feet are stiff, that is when we require medical assessment, whether it is something called as a rheumatoid arthritis, which is an inflammatory arthritis of the whole body, which requires medical management and should not be ignored, or whether we are having the bones which are weak, osteoporosis, even in young people. See, what we see in India right now is a lot of osteomalacia. So there's a lot of confusion between osteoporosis and osteomalacia. Okay. So osteoporosis is basically,
I request you to please keep yourself on mute. Sir is talking right now.
so basically osteoporosis is the whole bone mass decreases as we age or as the hormones are not there or because of certain medical conditions. While as osteomalacia is softening of the bones. The bone structure is there, but the bones soften. We don't have adequate vitamin D intake, so the calcium, the mineralization of the bone does not take place, and ultimately the bone softens. So this is a nutritional problem. It can be because of certain kidney diseases, liver diseases, but generally it is a nutritional issue because adequate amount of vitamin D is not ingested, not taken, and very commonly seen in Indian populations. In very young children, we call it rickets, wherein you have the bow legs and various other deformities. But even in young adults, it's very common to see in India that we have a lot of osteomalacia, wherein simple, we can have even fractures of insufficiency. We have neck femur fractures, both sides, young females. And when we investigate, it is simply vitamin D deficiency, and a simple prescription of vitamin D and calcium supplements takes care of that. So one needs to investigate if the pains are persistent, if the pains are regular, or there is a rhythm to that pain. When you wake up in the morning, everything is swollen, everything is stiff, then you need to see a doctor and take care of osteomalacia. So vitamin D levels, maintaining vitamin D levels. We have adequate sun in India.
Yes,
We have a lot of sunlight in India, but still, because of our practices, we cover our bodies. We do not go out in the sun, probably because it's too hot, or because of other socio-cultural associations. We do not go out that much in sun. We are not outdoor people. We do not call ourselves outdoor people. And ultimately we end up in vitamin D deficiency. Most of our population is vitamin D deficient. And that can lead to osteomalacia, which can lead to pains like even on walking, you will have a shin pain. A lot of other stress fractures can develop because of that. So that thing again has to be taken care of.
yes, sir. That is actually very true. In India, we have we have the sun which is so bright. So many people from abroad come here to specially take the sun also. And we in India, living with the best of the sun rays, do not take it so many times.
Absolutely.
I think it's a reminder which we should have it all the time. So thank you for explaining that bit. So another question, a lot of people get confused with sciatic pain. Can you please explain that?
Sciatic pain is a very, very broad terminology, basically describing all the compression pathologies. Whenever there is a nerve which is compressed in the lower back and causes pain in the legs. So basically the pathology is in the back, wherein the nerve is compressed because of a disc prolapse or because of so many other reasons. A nerve is compressed in the back, but the pain is experienced in the legs. Okay, and because sciatica is because the distribution of that pain is along the nerve, the sciatic nerve. So a broad term called sciatica. But basically, it's probably a prolapsed intervertebral disc which causes leg pain, but the pathology is in the spine. That's
Okay.
How we can classify as sciatica.
So that's what sciatic is about. So there's one more question. How does one check their bone power, especially the lower bone?
Okay. There are various ways to check the bone strength. Basically, the bone density. What is commonly used is DEXA scan. That's a dual energy X-ray absorptiometry, wherein a small dose of X-ray radiation is given to the bone, is given to the whole body, and then we see the amount of that X-ray which is absorbed by the bone, and that gives us an idea about the density or the mass of that bone for a particular volume. Okay? So that is how we measure. We can also use a CT scan or a biopsy of the bone to actually measure it, define it completely. But generally, the DEXA scan is what is a standard measurement. Even though the DEXA is not completely accurate, but it gives us a broad sense of what our bone strength or bone mass is. It's basically a DEXA scan.
Okay.
We can also have indirect evidences by X-rays. Sometimes even a simple X-ray, you can find that there is a small note at the bottom of the X-ray reporting that the bones appear osteoporotic. Because what we see on the X-rays is the cortical part or the walls of the bones and the central part, that's called the medulla. Generally, the walls have to be really thick. The central part has to be thinner, or if we combine the two walls, they should be at least equal to the central canal.
Okay.
If the walls are much thinner, then we can have an idea on the basis of X-ray itself that the bones are very weak and osteoporotic and may require some management.
Okay. Okay. So, last few questions. How to prevent stiffness? I had a case of right foot ankle fracture.
Okay. 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 See, it's very broad, but now modern day management of fractures, if we are operating the fractures, the moment we operate, the whole idea of a surgery is that we can start movements immediately after surgery. Okay. And if we start movements immediately after the surgery, then stiffness should not set in. Okay. For example, it was treated conservatively using a plaster or any other method. The day the plaster is out, you should start using your ankle, moving it, even if the doctor has advised you not to put weight on the ankle, but at least you can move it throughout the range of movement so that the stiffness does not set in. Okay. Sometimes the stiffness is because the fracture has not healed in the place where it should have. That's called a malunion. And then a surgical correction is required. But otherwise, if immediately after fixation or immediately after your plaster has been taken out, you should start exercising. You can consult a physiotherapist, that will help. And early mobilization in fractures will not lead to stiffness.
Okay, I think it's again a vast understanding, right? Thank you, sir. So quickly, we'll wrap up the session. And last question, sir, some special recommendations or advices you would like to share if we talk about children's bone and few cases of adults as well, both women and men, and the elderly also, how to, few tips if you'd like to share quickly with us. Starting from children.
Starting from children, see, parents are responsible for adequate nutrition of the children. If we see children coming with rickets, as I told you, nutritional deficiency, it's very irritating, and we should have legislations to punish those parents. So they should be aware of what a standard nutrition is, that their children require some amount of calcium, and their diet should have proper vitamin D and calcium to the diet of children, because children do not choose their diet. It's the parents who will feed them. So it's absolutely unacceptable to see a nutritional deficiency in children. As they grow older, in young adults, if we avoid carbonated drinks, smoking, alcohol consumption, and then shift to our conventional diet, which was pretty decent and should give us good health. Exercising, weight-bearing exercises, running, jogging, jumping, skipping, cycling, whatever is possible, swimming, whatever is possible, wherein you exert your muscles, put load on the, if you can go to the gym, do some outdoor activities, play, all of them will help in improving the bone health. As we grow older and have less and less time for outdoor activities or activities, so even in office, you can do certain exercises, like I told, the quadriceps exercises, the static quadriceps exercises. You can do the neck isometric exercises, even the shoulders, so that some amount of circulation takes place and the bones remain healthy. At elderly state, we should evaluate them for osteoporosis, and if they are osteoporotic or they have a tendency of having osteoporotic fractures, then we should start on supplements and the osteoporotic medications. Various classes of osteoporotic medications are there, which a doctor will start once they realize that the patient or the person is prone to having fractures. We should not wait for a fracture to happen and then start the osteoporotic management. But if we feel that this person is prone to developing fractures, anti-osteoporotic medications should be started much earlier. We should be mobilizing. To prevent osteoarthritis, extremes of movements beyond a certain age are not advised. even though our yoga instructors will ask us to sit down. But if you're not squatted for the last 60 years of your life, then at 60 you start yoga and try to squat is going to be difficult for your knees. So don't try to do extremes. There are always ways to do things without pushing yourself. So any activity which causes pain should be avoided. Any activity which hurts you, you should recognize that. Pain is an important feedback for our own body. We should accept that this moment is not meant for us, and we should not do those things if it's painful for our body. Those are the steps which you need to take, and keep on moving. Even if you are weak, you are feeling weak, with support, you should walk a few steps every day, even at an elderly age.
Okay. Sir, a last question and then we'll wrap up the session. A lot of times in every household, when we talk about the youngsters specifically, that ghee has been something which all our grandparents and parents have forever been telling us to have, and they've been having it forever. हमारी generation में आके ऐसे लगता है then when they say कि no, it's going to be fat, weight बढ़ जाएगा, but then they all say ghee is very important for your joints as well. So ये reality है या ये myth है या ये, please clarify it to us.
See, all dairy products are rich in vitamin D. So any dairy product is recommended as a source of vitamin D. So whether it's ghee or whether it is paneer or whether it is milk,
All dairy
a
products.
source of vitamin D. I would limit myself to this. A nutritionist would be a better person to further qualify. But as a dairy product, it should be rich in vitamin D, and that is how we take it.
Okay. Chaliye, thank you so much, sir. This was a very brief and a very informative session. I'm getting all comments when people are also thanking you. Thank you very much for joining and sharing your thoughts and informing our audience about it. And audience, thank you everybody for joining and asking your questions. And also, if somebody else also still has any queries, please write to us on social media.
Hello, ma'am. Hello, ma'am. I want to ask one question to Dr. Deepak.
Yeah, go ahead.
Hello.
Yeah, go ahead, sir.
Sir, I'm Rajagopal. I'm from Central Kerala, Trichur. And for the last 29 years, I am paraplegic. And my level is T10, T11 dislocation, and my L1 is fractured. And I had a Harrington rod fixed on my back, and it's paining now. I want to get it removed.
Yeah, that is possible. Surgically, yes, that is possible.
I can do it there in your hospital.
Yes, of course.
Can I?
Of course, I think Karishma, you might take sir's address and contact him for this. Yeah, it's possible, sir. But again, for even our spinal cord injured patients, how to prevent further bone loss, because weight bearing is an issue. So that is why we have the tilt tables, we have other things wherein they are made to put some weight going through their lower limb bones, even if they are easy.
I have developed a heteropic ossification on my hip and my left knee joint, doctor.
Those can be treated.
So it's difficult for me even to sit with the help of calipers.
We can.
I'm sorry to interrupt you, sir. We are running out of the session. We'll have to close the session. But
Okay.
all I would like to say is please visit our website, Indian Spinal Injury Center. You can even follow our Facebook page and our Instagram page and our Twitter page. And please write your query to us on social media @isiconline.org. I'll repeat it once again for everybody. Social media @isiconline.org. Please write your query to us and we will get back to you.
Thank you.
For now, we have to close the session. So thank you, everybody. Thank you so much, sir, for this insight once again. Thank you.